EAVAFM.com or call 07811 659 364. That's 07811 659 364. Serving the community, 102.5 EAVA FM.
The FM. This is the community show with me, Hashim Duale. Today, joining me with the Vijay. Vijay, say hello to everyone.
How are you doing, Hashim? Long time no see. I've not been on your show, right?
You've been busy, I guess. Today, I give you the honor to announce what it is that it is so important. I announce it everywhere in my social medias, but I give you the honor to do it today. What it is that we're doing today.
Okay.
The first hour.
So basically, Hashim, we have LOROS Hospice joining us today, and they've conducted some research around end-of-life care within our communities. So this is the third show that we are doing on EAVA FM currently. And basically what we are doing is we're talking to LOROS Hospice about their research, and they're going to tell us about what they have found, what they are doing. I'll let the doctor explain a bit more, the doctor that's conducting the research. It's very interesting. I think, Hashim, it's really important for us to talk with our communities and start the conversation around end-of-life care. How do you think? What do you think?
Indeed, because my previous life, I was working with the NHS, and I was community health coordinator. Yeah. So I know a lot about LOROS, but it is not about me today. Dr. Islam, please welcome to the show.
Okay, let me bring Dr. Islam.
And we packed, and we have.
How you doing? You okay?
I'm good, thank you. Thank you so much for.
I can't hear you. Oh, now Hashim. Yes. Can you start again? Hi, how are you?
Hi, everybody. Hi, both. How are you both?
Yeah. Would you like to introduce yourself to all our listeners?
Certainly. My name's Dr. Xavier Islam. I'm a senior research fellow at LOROS Hospice and an honorary lecturer at the University of Leicester. And I'm really privileged to be here today. So thank you so much for inviting me.
No, thank you for coming along. I think it's amazing the work you guys are doing.
And one of the things in this show is it's community show, and we like to always to bring what is important to our community, and the life and the health is very important subject, and it touches everybody's life. So I'm very glad that you accept our invitation to Abir, Dr. Islam. What I will try to do now is just to give you quick questions. This is about chatting. We call it chatting. It's informal. So this is your home as it's mine. As I always tell everyone in this show, they are host. You are the co-host with me today as Vijay. Thank you so much. My first question is, as Vijay introduced already, can you tell us more about how this study is going now?
The study is going really well. So just to give you a bit of background about the study, we've spoken to over 100 people in the past 3 years. This has included patients, their family carers, and also healthcare professionals involved in their care, as well as those that have been recently bereaved. Now, the individuals that we've spoken to, the patients that we've spoken to, have been from ethnically diverse backgrounds, and they've been extremely unwell, so terminally ill. And what we've asked them is about their experiences of accessing services, as well as their experiences of having conversations with the doctors and nurses that are helping them and supporting them through this difficult time. And that's what we've been doing. The reason for this is that, as COVID has shown us in the past few years, quite often patients' loved ones have not been able to be there when somebody's dying, approaching death, and the healthcare professional, the doctor or the nurse, has had to step into the family member's shoes. And in order to do that, they need to know more about the patient's preferences. What is it that they would want at end of life, in terms of what's culturally appropriate, what their faith needs are, what their religious beliefs are. So that's the understanding that they need to develop. They can only develop that understanding if we get the data, get the information from the actual individuals from the communities about their experiences, what's appropriate for them in terms of the services we provide, how can we make services more accessible for them, and how can we make the conversations that we have around end-of-life care, end-of-life and death and dying more acceptable for them.
Indeed, because the pandemic really showed a difficult and ugly bit of a bereavement side, and I'm very glad that the Loros staff step in and do that bit of grieving with the loved ones when they couldn't be there, and as it is very painful for those who couldn't even say goodbye to them. One of the things that I'm very fascinated about this project is. General public can ask themselves why it's important, why are you doing this, and what would you hope to achieve in this study? If you could amalgamate that into one question.
Of course. So the reason why we're doing it is it's really important for healthcare professionals to understand what somebody's wishes are, what their preferences are. And as I said, COVID has shown us that quite often healthcare professionals have had to step into the shoes of family members. So they need to know about these things. The reason why we're doing it is that we don't know enough about ethnic diverse patients' preferences or wishes and how appropriate these discussions are for them. So it's important to find out, is it something they want to do? Is it something that they want to have? It may be that they don't want to have the conversation, but that's fine as well. But we want to understand the reasons for that. The reasons we're doing the project is that the wonderful people that we've spoken to over the past years have told us they want to tell healthcare professionals. They want to be able to share their experiences with healthcare professionals. They want to be able to tell them about their choices and preferences, about treatment and the services that they want and so forth. So that's the reason why we're doing this.
Okay. Hashim, I think it is really important as well, because when we talk to different cultures and different faiths, for people from different heritages and people for end of life, everything's a bit different with different cultures, right? Is that right, Doctor, as well? And it's understanding that, and it's really understanding that. And me coming from a South Asian background, sometimes we don't talk about this in our community until something really happens to a member of your family or a member of your loved one. So that's one of the reasons why I think when you guys approached us, I was really happy that we could actually talk about this live on air, because a lot of the time I find when I speak to community members, they've had difficulty taking care of their family members during the end of life care treatment or anything like that, and they don't know how to approach or talk to health services. So is this another way which we can actually talk to health services about our culture or heritage regarding end of life care?
Absolutely. So one of the key aims of the study going forward is to create that partnership where we're working with communities. We really want this show, and obviously your links as well, Hashim, with the community, to have a bit of a call out. We want to speak to faith leaders, community leaders, those that are involved in any community organisations that would allow us to give us the opportunity to speak to individuals from the various diverse communities and understand what's important to them. How can we make services more accessible for them? As you quite rightly said, Vijay, it's really difficult because people don't always know about the services that are available. And one of the things that we found in this study is perhaps the information isn't accessible enough or in a way that's appropriate for everybody. So we need to have that conversation with individuals from the communities so that we can make the services more accessible, if you like, for them.
Speaking of cultures, when some of the cultures they are reluctant in and it is I always take myself as example. Bless her, she passed away. Was in end of care life. I would have, whatever it takes, stopped my job, stopped anything I was doing, and care for her at home. That's what culture teaches me. If I were to give to Loros, could you tell me what and convince me as a person who has that culture, what Loros can do for my, because at the end of the day, it's about the patient. It's not about me.
Yes, absolutely. But Loros do also provide support for the families and carers as well. So it's not just about the patient. Yes, the patient is key. We would provide them treatment either as an inpatient or outpatient, but we would provide support for the family as well. But I think what we want to understand in this project is what's important for the family. So if your wish was to have your mother at home, quite rightly so, we would do everything in our power to ensure that they could stay at home. But you'd have to express your preferences and wishes by having a conversation with the healthcare professionals when the time's right.
And the reason I ask that is that it is the culture, it is a stigma which tells me to do that.
Yes.
I'm not thinking clearly, because when you are about to breathe and you are about to lose and the reality hits you, you're not thinking well. And there are barriers that people have with them, like cultural barriers, things like that. So I will be thinking, okay, why? Because if it is best for my mother and I cannot care for her at home, yes, I'd rather be convinced that Loros and the nurses in that environment is for her as well. So kind of how someone with that stigma, because I take on myself when I'm talking about my community, had a cultural barrier to break it.
I think the best way of doing that is having that conversation for you to explain to the healthcare professional why it is you're so against your mother perhaps coming into the hospice, and then create that conversation, have that conversation. It's only by working in partnership that we can make those services more accessible for you. So maybe it's a little bit about misunderstanding about what the service is. Quite often people think you have to pay for the service at the hospice. It's not, it's completely free. It's open for everybody across Leicester, Leicestershire, Rutland. You have to be accessing the service via a referral from a healthcare professional, such as a GP, a consultant, and so forth. So I think it's just demystifying, some of the things around what the services are and what they provide, but also having a conversation. Healthcare professionals need to develop this authentic curiosity as well, asking somebody, what is it that's important to you? I want to know more about you. I want to know more about what your preferences are. Why is it you want to access the hospice? And then perhaps demystifying things for you.
Indeed, really. It is
Absolutely.
very good and educational, even for myself, someone like me who thought that they knew all. This is important for the ears of many community members. The conversation, the word that you use there is conversation.
Absolutely.
To be had, so that if we are human at the end of the day, and the communication is most important tool we have. Vijay, can you come in, please, in the discussions that we were having?
No, I think both of you absolutely right. The conversations start with communities from different cultures, heritages, diversities. I think it's so important. But I just want to go back to the actual project that you guys are researching right now. Who's involved in doing this project, and how is it kind of set up in terms of how are you reaching the people and who's doing this research?
Okay, so the project itself was funded by the National Institute of Health Research. So it's a nationally funded project. We're a group of researchers that includes academics, but as well as doctors and nurses. And we also include members of the public, but most significantly those that have been recently bereaved. And we've all worked together to develop the best approach to speak to individuals that are either patients, terminally ill patients, and also those that have been recently bereaved. So it's a group of individuals, if you like. It's this partnership working again, and because it's a difficult project, and it's a very sensitive piece of work, and we need to make sure we're doing it in the most respectful way as we can.
And when did it start?
So it's nearly 35 months. It'll be 35 months at the end of September, actually, this year. So nearly 3 years.
Wow. Okay, Hashim, next question. I know you've got lots to ask, Hashim.
Exactly. And one of the things that I liked about is how you're reaching those people who you are targeting for them. Because one of the things that I learned is in our show, people, when they listen and they want to be part of it, how you reach people to be part of this project.
Well, obviously, going forward now, we've already spoken to the patients and the bereaved family carers, and we've accessed those individuals, various means, healthcare professionals, as well as community organisations. But going forward, we really want to have the conversation, open that conversation within the communities. So I should have said that although we've reached quite a diverse number of communities, some of them we haven't, such as the Somali group, a Bangladeshi Jewish community, and we'd like to speak to community organisations, faith leaders, and what we have as part of our research team more recently is community liaison workers, and they're going to be holding a number of events. within community groups that are already established. And hopefully that you'll be able to link us with, or perhaps your audience will be able to link us with, where we'll go and talk about the project and find out more about what's important to the individual communities across Leicestershire, Rutland and Nottingham and Nottinghamshire.
Thank you very much. One of the things that I found out is very sensitive subject because when you are about to lose your loved ones, it's very sensitive subject. How to tackle and how do you go about this when you're talking to your to the people who are responding to this research?
Yeah. Hashim, I'm sorry, doctor. I just want to say, Hashim, this is an amazing question because I've really found it difficult to talk to people about this. You know, since we've been live on EAVA FM and we've started this, thanks to Loros for kind of working with us on this. But it's so sensitive. Like, I just want to say, yesterday's show on the Polish when the Polish show with Magda, she asked me the same thing off air. And I thought today I have to mention this on air. We don't like talking about this subject. It doesn't matter which community we're from. So Hashim, how do we do this? How do we start open the conversation? And this is where we're going to ask you, Dr. Zobia, can you help us in this or give any advice? Or I know there's no correct way of starting the conversation, but you know, if that makes sense.
Absolutely. I think the past few years has helped us have that conversation far easier because of what's been going on with the COVID situation, and it's been at the forefront of everybody's mind. So I think if there's a time to have that conversation, it's now. We need to have that conversation within communities. We need to raise that subject, demystify it, you know, but that's where we need to work with communities and understand why it's such a taboo, as you say, in various communities. But we need to learn from each other. I think that's the next step, I would say.
If I may come in, one of the cultures, it is the God who knows when somebody dying. So if even the doctor tells me, yes, you have 3 months or whatever it is, even though with evidence and that some cultures and some religions and how the people were brought out will automatically say, no, I don't accept. You are not a God, and you are not to tell me when I'm dying or not. And that refusal itself makes absolutely impossible the person to talk about the care. So they close themselves if they are able to talk. Even not only them, the people who are supposed to be caring are the same culture as well. So that closeness, how we can open, that's something that I always had a difficulty with in getting into.
I think it is a difficult area completely, but the only way that healthcare professionals can work with individuals is by understanding about that culture. Why is it that you feel like that? But it's fine to feel like that as well. But unless the patient or their family say, I don't want to know more, I don't want to know more about the treatments that are available, what have you, or I do want to have treatment to the last minute, you won't be able to plan that for them, for the individual. So I think it's being comfortable enough or have that trust with a healthcare professional, because what we're finding, trust is key. Trust, building that trust. It may also be that those conversations can't be held just at the same time, Hashim. It may be something, small baby steps, if you see what I mean. So it's something that you have to take a stepped approach. So you don't just say, right, we want to talk about resuscitation, or we want to talk about, you know, stopping treatment or whatever, or the end of life completely. It's something that you have to build up, I think, is key.
And also say, excuse me for I take you all your time today, because this is a subject that I'm so passionate about it. And when I have a expert like you on the show, it's not every day. One thing that I find out is, and you talked about earlier, it's also talking to the health professional, how they break. The important thing is I can say same thing in different ways.
Yes.
But if I come to you as a son of a mother who's terminally ill, and without hesitation, I tell you, your mother has got a 2 month, I will not accept. Yes. Some cultures, yes, and they will be saying, okay, I have 2 months and I'll make most of it. I will plan. They will come to you. but some cultures don't. So it is about how you break the first the information to the patient and how you treat afterwards. That that baby step you talk about is the most important bit in different cultures and different. Vijay,
Hashim, you're absolutely right. It's breaking the news, the sad news that somebody has got a terminal illness or is very, very ill, or is how do we do this? And I'm sure within different communities or even individuals or even individual families, I find having the conversation about these things, as we're aware, the pandemic, a lot of people have passed away that we know, and I wouldn't say it's easier to talk about it. It's just we're seeing a lot more of it now. We've seen a lot more people pass away from various age groups, from various communities, from various heritages, with various backgrounds. So having that conversation is not easier, but we're just having to do it more often. Like over the last 1 week, I've spoken to people about, I think it's 3 deaths. 3 people have passed away that I know of, and we ask the question all the time that why are people passing away or a lot more? Is it because we're getting older and we just know more people, or is it and with the pandemic then coming along? So I think it is a good time to start the conversation now about how do people want end of life, because no one really knows. Like somebody in their mid-30s, they would never expect them to be at the end of their lifespan, or so it's about speaking to them now and having something ready. Maybe they've got their certain wishes that they had in their mind. I don't know, Dr. Zobia, is that right in what I'm saying?
Yes, I think so. I think it's about letting others know, letting loved ones know what are your preferences, what are your wishes, so that if you're ever in a situation where your loved ones can't be with you, they're able to inform the healthcare professional. This was, this is what this individual wanted. So I think that's absolutely right, Vijay.
And the other thing, because I will come to all other questions later because I'm prepared. So let me go through my questions first. So,
of course, Hashim.
Thank you. I'm the boss here.
Yes, you are. You are the host.
Thank you. Tell me more about, because it's something that I really passionate about it. Tell me more what you have found so far in these studies.
So I think I've already said that trust is key, that people are telling us, they're very open about what it is that's gone well, what's not gone so well. So in terms of what does go well is once trust is established, that is very helpful in having those conversations, in people wanting to establish what their preferences are, what's accessible to them, what's acceptable to them, what's appropriate to them. So one way of doing that is for healthcare professionals having what we call authentic curiosity. So asking the question, what is it that's important to you? Another thing that's key is communication. And communication, not just in terms of language, but body language, everything. So these things need to be communicated in a way that's appropriate to that individual, don't they? So I think that's something else that's come out, that communication is key. In terms of things that perhaps have not gone so well, people have been very open and honest with us, and they have told us that it's actually the information about the services that are not always accessible. Where do they get information about services? The best way for that, and how that information is presented as well, can also be quite difficult to comprehend. And other things such as having a more joint approach between services, so that services are not so disjointed, so they're not having to repeat their case history every time they go and see a new consultant or a doctor or a nurse.
Okay. Thank you so much. Those who just joined us, this is EAVA FM 102.5, and you are listening really good subject today, opening the conversation about the end of life with Loros. Dr. Islam is here. Vijay, go please.
Okay. Just want to say we will be going on the commercials at 12:30. But before we go in there, I just want to talk a little bit about a lot of the time when we speak to communities, or people from different communities or diverse backgrounds or hard to reach communities or whatever you would like to say. A lot of the time you mention trust, and I think trust is really important. A lot of the time I speak to a lot of people on ground zero, on the ground, grassroots communities, and they say, we don't really want to talk to the healthcare professional about this because they're going to say this, they're going to tell us to do this, and we don't want to do this. So I think trust is definitely an important factor that takes place in sharing your end of life, kind of what you want to talk about, any kind of discussion point. So I think trust is definitely there. Have over the last 35 months you've been doing this research, have we spoke about a different approach from healthcare professionals when talking about end of life care to communities? I think that is, for me, is a key aspect. Also, communities understanding that we need to break this barrier and we need to talk about it. But also in the research, has there been anything that's been found out in terms of the way the healthcare professionals or the healthcare industry will work with communities? That's my question. It's quite in depth. A lot of people did ask me this. They said, it's great that the research is going on right now and we really would like to get involved, but is this going to make changes within the healthcare service in itself, or will it just be the same? Why do we always have to, as communities, need to make changes? Is there going to be changes from their perspective as well, and look more at our communities and kind of look at our faith or our cultures? Hashim, do you want to add to that? Because I know you work with a lot of the East African communities that have arrived. How has that trust factor been for you?
It is important because the trust factor, sometimes people know more than a messenger rather than message. So they relate more with the messenger who's... one way I learned is that the health professionals and anyone who's doing those kind of things, they need to use the messengers of the communities so that they trust more. I'm talking about my personal experience with the communities that I work with. And as Vijay say, sometimes they might, and after this, we will give you, I have only 21 seconds to go. And I'll talk about this more in depth later. But Dr. Islam, I will be going 3 minutes commercial now. And
then you can tell us a little bit more about,
and we will tell you
how
about
it's had the impact on the healthcare.
In 5 seconds we go. This is EAVA FM 102.5, and this is the community show with Hashim Duale.
EAVA, sharing the richness of cultures. This is EAVA FM.
Grill Shack, Leicester's finest jerk chicken specialist, giving you that carnival taste all year round. Jerk chicken, rice and peas, coleslaw and fried dumplings. Yummy. Come and check us out in the heart of the city, 167 Belgrave Gate, Leicester, LE1 3HS. Try our boneless jerk range in a wrap, gourmet burger, pita or strict. What we do in our jerk range, we also do in Peri Peri. Online delivery via Just Eat, Deliveroo, I'll Get It and Zoom. For collection and orders, call us on 0116 262 2885. That's 0116 262 2885. Grill Shack, the authentic taste that brings a smile to your face every time.
Serving the community 24 hours a day. EAVA FM.
हर साल 4 वयस्कों में से 1 मानसिक रूप से अस्वस्थ होता है। हम लेस्टरशायर और रटलैंड में वयस्कों के लिए मानसिक स्वास्थ्य सेवाओं में निवेश और सुधार करना चाहते हैं, ताकि लोगों की व्यक्तिगत जरूरतों का समर्थन करने के लिए स्वास्थ्य सेवाओं के साथ मिलकर काम करना आसान हो सके। चाहे आप अभी या भविष्य में इन सेवाओं का उपयोग करें। परामर्श में अपने विचार साझा करके हमें बताएं कि आपके और आपके परिवार के लिए सबसे महत्वपूर्ण क्या है। www.greatmentalhealthllr.nhs.uk पर जाकर एक सर्वेक्षण पूरा करें या 011629500750 पर कॉल करें और हम सब मिलकर बदलाव कर सकते हैं। आज ही ग्रेट मेंटल हेल्थ की ओर कदम बढ़ाएं।
EAVA FM.
1 in 4 adults are unwell with their mental health each year. We want to invest in and improve mental health services for adults in Leicester, Leicestershire and Rutland to make care easy to access, with health services working together to support people's individual needs. Whether you use services now or may in the future, tell us what matters most to you and your family by sharing your views in a consultation. Complete a survey at www.greatmentalhealthllr.nhs.uk or call 0116 295 0750. And together we can make the change. Step up to great mental health today.
This is EAVA FM.
Everyone can now get free rapid COVID-19 tests twice a week. They show your results within 30 minutes. They also show you're doing what you can to protect your loved ones, your friends, your workmates, and that you want to keep life moving again. Around 1 in 3 people who have COVID-19 have no symptoms and are spreading it without knowing. That could be a friend, a relative, a workmate. It could even be you. Rapid tests are easy to get from nhs.uk/get tested. Let's take this next step safely.
EAVA FM is a multilingual radio station serving the diverse communities of Leicester on 102.5 FM. For advertising and sponsorship, email sales@eavafm.com or call 07811 659 364. That's 07811 659 364. Serving the community, 102.5 EAVA FM.
Community. As I was saying, Dr. Islam, before we went to the commercial, the ways and the Vijay's question and observation before, please can you come in and elaborate more what we were talking about earlier?
So I was just saying that before the commercials, I think it's really important that there's not only changes within our communities, but also is there been any impact on the way healthcare services will be providing or asking communities? I know we've spoken about it before. So yeah, Doctor, I'm going to take it straight to you. Rather than us talking, you have the answers here, hopefully. So here we go.
Okay, so one of the key outputs, if you like, of this project is to develop resources for healthcare professionals. So this is going to be in the form of training resources. So the resources, if you like, are going to be developed around the stories that the individuals have told us about their experiences of end-of-life care planning, the services they've accessed, the conversations that they've had, and the sort of themes that have come out of there. So themes like what I mentioned, trust as being a key issue, communication as being a key issue. And this is all going to be utilised in the e-learning resource that's going to be available free of charge for NHS staff, hospice staff across England. It's going to be hosted on an e-learning platform or on Health Education England. So that's what we're going to be doing in terms of development and training. So yes, definitely will have an impact on the way that healthcare professionals will have those conversations going forward. There may be guidance and tips on there as well in terms of approaches also. So that's will have a direct impact, if you like, on healthcare professionals going forward when they come to have difficult conversations, such conversations around end-of-life care planning with ethnically diverse patients and their families. Also going forward, you're absolutely right, there needs to be more collaboration between healthcare professionals and communities. And I would really like this opportunity to have a bit of a call out, if you like, to faith leaders and community leaders to link up with the hospice, link up with Loros, and let's start having that conversation. Allow us to come and speak to individuals that you influence within the communities, within the community groups. Allow us to come and have a conversation with us. Allow the community liaison workers that we have as part of our research team to come and ask people about their experiences. What's accessible to them? How can we make conversations more acceptable, more appropriate to them, taking into account their individual beliefs, as you've mentioned, Hashim? So that's the next call, really. So it doesn't end there. We've only just scratched the surface with this project.
I understand, and it's ongoing, and we will give you all the support we can here. Before I ask you the second question, I'll give you an anecdote that I witnessed. There was a big debate, and there was someone who was an end of the care female, and instead of us thinking of the best care and all that, the last days of her life become a crying session, and we are very tight community, and people were coming in numbers, and I was saying, look, she did not die yet, leave her alone, and that message is difficult to reach some communities, because the last thing the person needs, because even though she was ill and she wanted to be alone. She couldn't say it because of the culture.
Yes.
Because you could not be rude of someone who come to visit you in numbers, and they cry as if you're already dead. Those kind of conversations need to be had, and the reason I prompted this anecdote is my next question. My next question says, what did you find gaps in improvement that might need here when you are doing this research? I'm talking about this. I just give you one about the families and also the healthcare. Have you seen any gaps there that needs improvement while you were doing this?
I mean, absolutely. So I think I've already mentioned that the patients, their family members, and the bereaved carers were all very open and honest about some of the gaps, and that was about information about services. So I think in that anecdote that you gave me, perhaps it's about giving people the information about what services are available for them and what they can access, and that's not necessarily going against somebody's culture, but it's there to support the family, if you like. So it's about informing individuals about what is available for them, what they can access in a way that is appropriate for them, perhaps culturally as well.
And the other point I was making is that some cultures, they need to be criticized, because I'm criticizing my culture here. Instead of helping that person who was dying, we were preoccupied in being brief and breathing here and showing our, yes, in our way, we were showing empathy. We were showing the sympathy. But she could have done with a rest. She could have done with more spending time with her own kids, but we took all that time. So what I'm trying to do here is, if you're following me, is to also engage and break those barriers and say, look, hold on, let's do and plan this end of care plan for anyone. The palliative care is a very complicated matter for any culture, but when it comes to some cultures, we need to be going in and deep and make sure we do what's best for the patient rather than the others.
I think that example that you've given is a fantastic example, because that in a way highlights, doesn't it, of when things don't necessarily go in the benefit of the patient. So that's the memory then, isn't it, that the family is left with, because ultimately when the patient dies, it's that last few days, the end of life care experience that they've had that will stay on, won't it, will be with the family members and so forth, and the children that you mentioned that she didn't get to spend time with. So I think this is why it's even more important to have that conversation, isn't it, within communities, within the local diverse communities, and sort of unpack some of these myths around what services provide and what they're there for. What is end-of-life care planning? Is it such a taboo in somebody's faith or culture or religion? Let's talk about it. Why is it a taboo? I think that's the key, isn't it, is to open the conversation so that we can start demystifying things.
Indeed, some cultures, it is taboo, and we need to break that taboo. This is where everyone needs to get involved, because whether we like it or not, we will go away from this life, and we want as best way and care and shape and dignity to live the and also education is two ways. We also need to educate our own people as well, not only the health professionals. The anecdote I took it, I did it on a provocative way to make sure that the education is two-way street. It is not only one-way street. Thank you very much. Vijay, please. Sorry, I talk too much. Stop me if I take over the show.
We're all the same, I think, Hashim. We do love getting the points across and talking. I just want to say, look, I come from a South Asian background, and as growing up, and within my family, I'm very lucky that within my family are quite open and talking about various conversations. And this stems back. Education definitely plays a part, but also my grandparents. I want to give a massive shout out to my grandparents right now, because they're the ones that have taught me to have these difficult conversations. And when we talk about stigmas within cultures or religions or faiths, etc., I think a lot of the time it's individual choices, and they put up that barrier, and they're using the excuse of their culture or their religion that they can't speak about this. Because after speaking to my grandparents, they've had literally no education whatsoever from where we're coming from, but they're very educated in their life experiences. And they've always told me, Vijay, you need to talk about end of life care or treatment or things moving forward, about your future, what you're going to do, planning ahead. And there's been no barrier. They said, in our religion, this is what it says to talk about. In our culture, this is what we should be doing. So a lot of the time people use culture and heritage and religion as the barrier when there is no barrier within them. Does that make sense in what I'm trying to kind of get out there?
Yeah, I think absolutely, Vijay. I think that's why it's key that we work with faith leaders, because they can influence people, can't they? They can be intuition, if you like. Yes, you can have these conversations. There's nothing in the religion that says you can't have these conversations. Like resuscitation, for example, or treatment preferences, or not having groups of family members around. Just talk to cultural leaders. So talk to faith leaders. So I think we need to work with them, so that we're then able to reach those communities, so they don't feel like they can't do certain things because of religion or culture.
Yes.
In fact, it's about understanding, isn't it?
Yeah, absolutely.
Permission, if you like, that actually, no, you can access those services. Nothing in our religion or faith or culture says that you can't access those services.
Yeah. And that's what we generally do find, that in a lot of religions that I've spoken to, and me being part of a community radio station, having access to certain faith leaders or certain communities, I've spoken to people that are very knowledgeable, and they've said, Vijay, there is no barrier. This is something which is made out of, and I'm sure, Hashim, you've kind of found the same thing, that there is no barrier in our religions out there to talk about these things. It's our closed communities that get this out there, and I think that's important to mention. Hashim, what would you like to say on that?
What I find out is sometimes there is a fine line between the culture and religion.
Yes.
And if you read any script, they will tell you more about how you have to prepare in dignified way the death for your loved ones, and be prepared yourself as well. So it is script, but sometimes it is the culture which takes over, and some people interpret the culture as a religion, and that's another way, another conversation that need to be had in many. And as you said, Dr. Islam, it's important that faith leaders bring that down, and also community leaders also to bring in and separate that, because what I don't want is accept someone is dying and then crying on them, or don't accept. There's two ways, you see, depending how you see that, because at the end of the day, what we are trying to do, and what LOROS good work is they're doing, is to make sure that the end of the life of that person ends the best possible way we can, and to make it more, as I put it, a way and ease, and also the loved ones to enjoy at least the last bits of and celebrate, if you wish, sometimes of the life while they are alive.
Celebrate. Absolutely.
So this is where I'm going with my communication. This had to have, and I thank you very much. Before we go on,
Hashim.
Before I go on, because I'm a bit scripted guy, so we can put it in there. One of the things is that if you would like to leave messages with the listeners, what would be those messages?
The main message is, please get in touch if you want to work in collaboration with us, really, because that's the next step, isn't it? We are very keen to come and hear about your experiences. We want to know how to make services more accessible for you, how to make conversations more appropriate for you, how to make them more acceptable for you. We want to know about your experiences, what matters to you, what are your preferences, and that's the only way we can work going forward.
Let me play here a very some cultures. They know what is hospital is.
Yes.
They will know what is caring for someone who's having difficulty and get medication. Hospices like you that work on palliative care.
Yes.
What do you do for the community? Why would I be interested in your services?
Because we're not just there for the patient, we're there for the family and the carers as well. We provide a support service for them as well. So it's not just for the patient. We are also a free service that is available at this really difficult time for people. So I think there's this misconception, isn't it, that we charge as well. And it's not true. We're there for everybody.
It is not about the money. What I'm talking about, can you explain more in layman's way?
Yes.
Palliative care. Why the communities might need that palliative care?
So it's providing support for the patient when they are so unwell that they may die, that there's no treatment, there's no cure, if you like, for their illness. So we're there to support that individual, but not just that individual, but their family as well. So to make that end of life, if you like, as easy for them or as good and appropriate for them in terms of their preferences, in terms of their faith and religion, as much as we can do. So exactly. that memory that they have of that loved one being cared for in the last few days is a positive one as opposed to a negative one.
Exactly. This is what I want. For example, I'm educating myself and I'm educating. When I'm sitting in this chair, I have to think in the shape of the person who never had things like this, or culturally, because we take for granted that people on the street know about services. So the question that I just asked you is about. And another one, it's important for me. These findings that you have, what will you do with it?
So, as I mentioned, it's going to be developed as an e-learning resource. So we're going to develop the interviews, the conversations that we've had with the various individuals that are involved in the project. We're going to develop fictionalized stories, which are going to be presented, if you like, in an e-learning resource. So training materials for healthcare professionals, such as doctors and nurses, in the best way to have those conversations. So that's the output, if you like, of the findings. But it's, as I say, we've only just scratched the surface. There's so much more work that needs to be done, Hashim. You know, we want to go and have those conversations with the communities, don't we?
And so far, any differences that you can see since you started that this research have done so far?
Absolutely. The fact that people are very willing to engage with us, and we feel so privileged that they've wanted to have these conversations with us. So we know it's not about people not wanting to have the conversation. Perhaps it's about giving people the opportunity to have those conversations and say it's okay to have those conversations. So that was one of the key things, is that we are able to do this work. It is sensitive and you've got to approach it in a respectful manner, be respectful to those around you, but you can do this work, and there's a need for this work, isn't there?
Yeah, I can give you another anecdote, and you understand where I'm going with this. Yes. There was a resident in Loros time ago, and when from the community, and the community, when they find out and they were explained to, we went in numbers there. And trying to say goodbye to our loved ones, and that's the culture. Nothing I can do about it. Even the hospitals will tell you when one of our member community is there, how them. And the problem is that each and every mother, she has got time out, same time when the children are at school or the dad is back from work, and they were coming in carpools. And you will find out 6, 7, sometimes 10 people wanting to see. And some cultures, it is appropriate to do that. And I find out the hospitals, hospice, they have got policy. I'm talking about pre-pandemic now.
Yes, pre-pandemic.
Yes. And there were difficulties that time because there are other residents as well. We allowed when we're talking to each other, we want at least to ease this person's, and that way is the culture. So something like that, how you are prepared and how you are preparing the hospitals as well when this cultural thing is in there and will come in numbers.
It's difficult, isn't it? And obviously in the current times, something like that would be really difficult. I mean, as I said, this is why it's so important for healthcare professionals. They've been having to take on the role of family members. But going forward or being pre-COVID, I would hope that healthcare professionals would work with the family to try and ensure that their wishes are met, so that family members are able to come and visit. Perhaps not all at the same time, but perhaps, one at a time as opposed to a whole group gathering. But it's about working with the family and also making sure that those around them are safe as well, particularly in the situation that we're in now.
One of the things that I advised Loris that time was to, because the patient could have moved out from their room, and you have good background there where people could in the garden gather. Yeah. So that's how we resolved the situation, because otherwise it would have been chaotic. And it was the pleasure of the person who was there. They wanted to find, because she had a lot of extended family, and she was very famous person in the community, and everybody wanted to pay the respect. So that kind of small adjustment that I'm talking about, and without starting miscommunication between the carers, this time Loris, and the community. So this was the anecdote that I was going on to, and something that I find research like this.
And was that something, Hashim, that you were able to do, or is this just an example you're giving me? Was that something that you were able to do? Because I find that fascinating.
It happened. It's on record. Even if you go back years back, you find out what I'm talking about. It's there.
Yeah. I think we've got to be careful in the current climate.
No, I'm definitely aware, because we will not be in this lockdown forever.
No.
And this is what I'm trying to go through, because it will happen, and it might go to other level.
Yes.
Before I go to anecdotes, let me come back to my questions, scripted ones. What are your hopes then in thinking ahead about this project going forward? Because it's important, as you said, it is you just scratching the service now, the future.
I think it's just having this conversation with you, Hashim, getting that knowledge from you about your own experience, your own culture, the way things have moved. I think those conversations are really important, so we can learn from individuals like yourself, those from within the local community, so we can start that conversation. That is what we need to do going forward. We need to have that collaboration. We need to have that partnership working with the community groups. That's the ambition going forward.
Thank you, really indeed, and the reason, because it's not every day that you have a very well qualified researcher, Dr. Islam, and I'm sorry if I was going ahead, because it's 16 years of experience that I'm trying to share with you, and my role was to be a community development coordinator. It's posh word for community worker, but that was my job, to understand both sides, health and the community, and where I could, I was coming in.
And I think we need to carry on this conversation, Hashim, because I feel like just having this dialogue with yourself and Vij today has been fascinating, and I'm learning all the time, and healthcare professionals will learn all the time, So I think it's important to keep this conversation going, and perhaps after the show we could continue that.
Not only, not because you're here, because the reason I'm very fond of this, and the way that Loris is being brave in going into this, and also being so selfishly sharing those resources with across the board. NHS, really, it is admirable work that you're doing, and I couldn't comment more. And I'm here. Vijay also agrees with me, because it is important, because if you are not doing this important work, we couldn't unlock all that information from the community, because my theory as a community worker is there is no such a hard to reach communities. That's absolutely nonsense. Absolutely nonsense.
Absolutely.
The only thing is you need to know how to reach them, because I think there's such terminology are being barriers now, people to get access to the services. You need to know each and every community that you're serving, how to reach them. You can't invent words such as hard to reach or because we are not horses, because even the horses are difficult. People say you can take the horse to the well, but you cannot make it drink. That is, you don't speak the language of horse. If he could talk, he will tell you what he wants. But we talk, we are humans. Tell us, and we will tell you. I'm sorry, I'm very passionate about this. And I take all your knowledge in one go. Your closing remarks before I bring in Vijay.
I wouldn't call them hard to reach. I would call them seldom heard groups, because that's what they are. And you're absolutely right. It's about working with the communities and understanding the best way of going forward. And I think that is with individuals like yourself, faith leaders as well. So that in the community organisations, you can access communities, but there's a way of working with communities. And this is why going forward, we have these community liaison workers, which are going to support us within that piece of work going forward.
Vijay.
Yeah, I think, great. Just want to reiterate what you both are saying. I'm loving the conversation. Hashim, I love that when people call us hard to reach communities. We've been doing this for a very long time, right, Hashim? And I think it's important to mention that as well. And just overall, the fantastic work you guys have been doing at Loros Hospice is amazing. Sometimes people message us and really wanted to talk about this more on air. And I'm really glad we've started the conversation between us as two organizations helping the community moving forward. Also, I know people can email you direct. Would there be, I know we're going to be finishing off in the next couple of minutes. So just any final words you've got, Doctor, about this and how we can keep moving it forward?
Just please do get in touch. As you've said, Vij, we are open and we want to have that dialogue. We want to have those conversations with individuals from the various communities, and we want to work with you.
And the other thing, this show is your show as well. Please, I hope that it won't be only one of. I'm talking to you and your colleagues in Loros. This is the show of the community. Please come back and tell us more about this and this vital job that you're doing. And thank you for being our guest.
Happy to come back, and thank you for inviting me again. Thank you so much.
And I hope that you enjoyed as we enjoyed here. And
I did. It's fascinating.
Thank you.
Thanks a lot, Doctor. Okay. Have a good day. Okay. Bye.
You too. Thank you. Bye for now.
Thank you ever so much. You've been listening.
Fantastic.
Thank you very much. Vijay, the essence of this show is doing something like this for the community.
Absolutely.
And I hope that our recordings can be shared again and again, because sometimes people might be busy when we're doing something like this. How we can get this hold on?
All the videos will be on our Facebook channel and our YouTube channel. They will not be going anywhere. They're not going to be deleted. It takes a little bit longer on our YouTube channel to kind of, I think, process, they say, and before it comes live again. But on Facebook, I think it's pretty much instant. So I'll send you the links anyway, Hashim, to share to the communities. I think it was fantastic today, the whole conversation that we're having. And also, we've also spoken about conversations within the community as well, other questions as well. So definitely we can carry on having Loros and various community organizations on here. So Hashim, go back to you before our commercials.
Thank you so much. Thank you so much. This is EAVA FM
102.5. And you know what, Hashim, your show is going to carry on straight after this commercial, but we will not be live. So we're going to close our live stream on our YouTube channel and our Facebook channel, and Hashim will carry on 102.5 EAVA FM.